Please do.
Okay, are things okay?
Yes, sir. You're live, sir. We are good to go.
Okay,
Sir, just request you to turn on the recording.
yeah. Okay, just a second. I need to close the door. Okay, so good evening and welcome. We are back after quite an interval, and today we have a very interesting expert guest, Dr. Purnima Gupta. She should join us shortly. She would be in her class, so might be she would take a couple of minutes of delay. So, as most of you would be aware, that we are now launching the roadmap to autism course from 12th of December, 16th of December. This time it will be of 6 sessions, and we have external experts on the subject who will be sharing their experience on autism. So we have Dr. Praveen Jain, Dr. Purnima Gupta, the psychologist whom we have today. We have Dr. Hardik Khamar, and we have Dr. S.R. Apte, the most senior, most occupational therapist who would be in our lecture series. Each of the lecture series each of the lecture will last for a couple of hours, starting at night 8 o'clock to 10 o'clock. And you will now, as compared to part 1, where I was the one who shared most of the sessions, most of the experience, I will be doing 2 sessions. The rest 4 sessions will be done by the other doctors and the experts sharing their experience in autism. So for those of you wish to enroll, we will have some time. We will put the details in the video below, and you can register for the session. We are going to have 6 sessions, and also be ready with your questions to Dr. Purnima once she's here. We are going to talk about psychometric testing in autism. So several questions that come to a homeopath's mind. Does homeopath really need a psychometric test to be conducted in a child suffering from autism? That should be the first question that occurs to a homeopath. Because for a homeopath, everything is got to do with the history. And if at all you need to do psychometric testing, what kind of tests need to be done? And more importantly, what is going to be the utility of this test? Because if there is no clinical utility in this test, it's no fun doing this test. So what is the utility in terms of homeopathic prescription is something that I will try to address in this next 30 minutes session with Dr. Purnima. And other than, correct, yeah, so Dr. Keyur, that is exactly what I'm going to answer. Other than just the prescription, where else does psychometric testing help us? That will be the question that I will try. We both of us, myself and Dr. Purnima, will try to unravel and answer this question. And let me check as to where is Dr. Purnima. If she has got some technical difficulties, I will just call her up and check why she has not been able to. Purnima is facing some technical issues. Just give us a couple of minutes till we resolve it. So, welcome, Dr. Purnima. Let me just get you into the spotlight. Okay, we can't.
Sir, if you go to people, there will
So, I'm going to the breakout room only, Kevor.
no, sir, in participants.
What do we do?
If
In
you go to
people.
participants, people or participants, you're able to see a three dot next to Purnima madam's name.
That I've seen.
If you click on that, does it allow you to add spotlight?
No.
Okay. Are you able to see her video and do you see this thing three dot or options?
No, nothing is there.
Okay. So, sir, I would request you to continue as it is because I don't see any other option.
Okay. So, that's why I was trying a breakout room, but I don't know how that functions. So, Purnima, have you unmuted yourself, please?
Yeah, I have
Yeah.
unmuted.
Okay. So, welcome, Dr. Purnima. Dr. Purnima is a PhD in psychology, and I have been working with her for now nearly 20 years. Right since the day when we started Ahmedabad Spandan, Dr. Purnima has been associated with her and seen our work, and we have seen her work. And I understand her to be one of the sharpest clinical psychologists with whom I have worked. Often there have been times where she has given me inputs to in terms of diagnosis or in terms of important behavioral trait of the child, or even given a feedback as to what is the parenting problem that's happening in the family, the dynamics of the family, which very often in our 2 hour interview or in our interaction with the patient, we are unable to see or we miss. Because largely as a homeopath, our focus is on getting the portrait of the case to understand the characteristic of the child and then to make a prescription. In the process, a homeopath very often misses out the background canvas, that is the family polity, the family dynamics that are at play in shaping up the child, whether it is a normal child or a neurodivergent child. And that is very important. If one needs to understand the child, one will always need to refer it back and see it in the context of the family dynamics. So, with this brief introduction, we begin our talk today. So, Dr. Purnima, why a psychometric assessment of an autistic child or a neurodivergent child is of importance in general to you as a psychologist? And maybe if you have been able to see our work, how do you think it would be important to a homeopath?
Thanks, Dr. Munjal. Just one thing to clarify, my PhD is yet not over.
Oh,
So
you're
it will
still
be
in the
over in
process.
1.5 year.
Okay.
So yeah. Yeah, but talking about psychometric analysis, I think one very fundamental reason behind using it is you need a direction at times, and the test becomes that direction. You need certain clear paths on which you can actually walk and also take along the parents so that they give you the exact information. But for me, while this information is being doled out, while this information is being shared, something else is also important, and that is uh, the tone in which the parent is talking, the eye contact that they establish with me, the kind of conversations parents are having with each other and with the child. So for me, psychometric analysis is not just limited to the questions that are written in the test, whether it is CARS or whether it is Indian scale for autism, but the non-verbal communication that's happening within the four walls of that assessment room is more valuable and is rather more substantial. So psychometric analysis does provide you information about the developmental milestones of a child. It does tell you where the child stands psychologically, cognitively, emotionally, socially. But what is more important for me as a therapist is that I can understand where the mother has been totally taking the control of the session without, letting uh, that be very obvious. The father is just not able to speak anything. So sometimes I have to ask the mother to keep quiet and let the father speak. Uh, there are parents where neither the mother has the complete information about the child's birth history nor the father has it. They would be asking their parents, the child's grandparents. So these are very important nuances in terms of understanding the dynamics of a family so that you know what is going to be the protective factor or the supportive factor in the healing journey of that child.
So, for a homeopath, this factor of the family dynamics may turn to become a maintaining cause for a difficult behavior of the child. So that needs to be addressed as a homeopath. We can address it in terms of counseling the parents, the family, and it could be in any other way that this can be handled. But an insight that this kind of maintaining factor is there, that will help to heal the child better by removing those obstacles. The other question, Purnima, is what would be the common tests that you would want to perform, either one to diagnose an autistic child where there is a suspicion that this child possibly has an autism spectrum disorder, and uh, what would tests would you do commonly, basically, in a already known case of autism?
So usually, the two most common tests that have been used for diagnosis is uh, CARS, Childhood Autism Rating Scale, and the other is the Indian version, which is ISA, the Indian Scale for Assessment of Autism. Uh,
Okay.
to be very honest, both the tests are good in their own ways. CARS is more comprehensive, though. But before you go for these assessments directly, I think what is more important is to understand the developmental history of not just the child, but also of the three generations before. It's important to understand whether grandparents or great grandparents or parents underwent any problem in terms of socio emotional skill development, majorly. The physical development may be fine, the cognitive development may be fine. But for example, in a lot of cases, I have noticed that either the mother or the father has a very deep introverted nature. So now, when you look at these introverted nature, when you look at these parents who themselves are not very comfortable in social context, it would not just aid as a piece of information to your CARS assessment or ISA assessment, but would also provide you an in-depth look into why the child probably is not able to come out of his socio-emotional regression as a child who is on the spectrum of autism. So I think CARS and ISA are important, but it would be suggested if you can run through the developmental milestones checklist just to be sure, and also clinical interviews. something that I have been talking about. Clinical interviews, not just with the parents, but also with the grandparents. It's important to understand, like, I had a mother who was so busy, so occupied with household chores and her office chores that she could never give enough time or spend enough time with her child who was on the spectrum. And this guilt was tremendous in terms of, how it was impacting her quality of relationship with her son, and how it was overall affecting the atmosphere at home, which was not at all conducive for the child.
So I understand the importance of family dynamics. Since today we are more focused on the psychometric test. So how exactly are these two tests conducted in your clinic?
So we usually, these tests are conducted in an interview form, because you have to read the statements or ask the relevant questions to the parents. In cars, there are no statements, but there are broad areas given. For example, verbal comprehension or verbal ability, or fear or nervousness. Now, fear, there is no statement given, but fear is given as a category. Now, as a psychologist, how do you understand that? Do you just ask the parents whether the child is scared of something or not? Or do you get into the nuances of it? Does the child even understand what fear is? Or is he fearless? Or is he careless? Or is he fearful of only noises or sounds, as usually ASD, children on ASD are? So there are categories and you have to convert them into relevant questions. And please understand that language plays a major role here, because largely these tests are in English. So when you're talking to a parent with Gujarati background who doesn't understand English, how do you translate those statements, or what kind of words do you use? That becomes very important in extracting the actual information that you're looking for.
Yes. So would you like to share one of your experiences in this area?
Yeah, I can actually share a case where when the parents came for the history and the assessment, during the assessment, I realized that the mother has severe anxiety issues, and she was not able to understand the questions I was saying, because she was going on and on and on about the problems she faces with the child, or how the family doesn't support her in household chores, how nobody understands that the child is struggling, how taking the child to therapy and various centers is a task assigned to her. So her anxiety was at the peak. Along with that, I could also notice her insecurities about, uh, you know, there was a subtle thought at the back of her mind that my family thinks negative of me because I have given birth to a child who is not normal, who is not absolutely fine. And
So
even
when
though the family never had this kind of a thought, the lady was living in this constant fear that one fine day the husband may just ask her to leave and marry someone else, and produce a baby who's normal. So her anxiety knew no bounds, actually. And instead of supporting the child's healing, this was a rather bigger obstacle in terms of healing.
so how did you manage to ask the questions and get the data of the test in a
I had to
situation?
actually tell her very honestly that, okay, so let me just tell you, this assessment did not get over in one session. It took me 3 sessions, because in the first session, I just allowed her to voice out her concerns. And of course, a bigger chunk of my assessment came from what she naturally shared instead of me asking the questions. The second and the third session was where I could put up some questions, but it wasn't really necessary because she had that tremendous need to vent out, that she gave me all the details even when I had not clearly asked her. So, for example, the question about how do you feel about your child, or what kind of support do you get from the family? I didn't have to ask this question to her.
Yes.
Uh, In Gujarati, probably you can ask the same question to the parent ki તમને તમારા છોકરા કે છોકરી ના વિષયમાં કેવું લાગે છે, તમને શું ફીલ થાય છે, તમને એવું લાગે છે કે આ છોકરો તમારી ઉપર ડિપેન્ડન્ટ રહેવાનો છે, do you feel ki આ છોકરો લાઈફમાં કંઈ નહીં કરી શકે? So you have to be very very precise and at on point in terms of how do you frame your questions, because getting information is one goal, but giving this assurance to the parent that we understand what their child is going through and then what they are going through is equally important.
Yes, so as we can see that the question has to be skillfully framed. A broad area is defined, but the precise information is obtained from the parent by skillful questioning. This is what even a homeopath does. And therefore, I personally feel the need to get this assessment done, because what Dr. Purnima is describing, that other than that answer to the questionnaire in the psychometric test, there is a lot of information that comes through during the process of testing. Therefore, a very good coordination with the clinical psychologist and the homeopath will definitely help the patient. The other, what is the difference? Because I increasingly see that with autism, children with autism, they are more and more doing the ISA test, which earlier was probably not available or not done that often. What has been your experience, and what is the difference between the two tests in terms of the process in which you do and the outcome?
ISA is very simple, if I can put it like that, because there are direct statements that you have to ask, and then there is a Likert scale on which you have to just rate the child. CARS would ask more from a psychologist or an administrator of the test. CARS
Okay.
would ask you to be really intuitive and observant while you are taking the information from the parent, because CARS puts this onus on you as an assessor. For example, I said fear as a category. Now, fear as a category is from 0.1 to 0.4. Now, 1, 1.5, 2, 2.5, 3, 3.5, and then 4. And there are
Yeah.
very, very minute differences in terms of if I have to say that the child is at 2.5 or the child is at. So 1.5 mistake also will cost you dearly, because the overall score will increase or decrease eventually. So CARS places more responsibility on you, and I love that because it's a challenge for me. I remain attentive. I cannot just assign an assistant the responsibility to assess the child. Whereas in ISA, it's a very statement-based test. Very simple. You just ask anybody or even ask the parents to read it out on their own and just fill the scores. And you can just then make a total of it and get the raw scores converted into standard scores. So I personally do not appreciate the way ISA is being used, because to be very honest, all introverts will actually turn out to be autistic at some or the other point if you judge them through ISA, the Indian scale of autism assessment. But CARS would be very, very precise. 0.5 also matters a lot. And that 0.5, the judgment of 0.5 to 1, it depends on your intuitive ability and observance. Could you really listen between the lines? Could you really understand what the parent was not able to say? And based on that, because see, the parent is also not spending all 24 hours with the child. The child also has his own quiet moments. So how do you get that information? So the 0.5 difference will be there. statistically also, if we look at the scores. So personally,
Yes.
I feel cars gives us much more, you know, authenticated information in terms of whether the child is on the scale or not.
So there is a possibility of a 0.5 score error in
Yeah,
each question with
absolutely.
cars, right? It would be a very
Yes.
human error because one may not remain as precise as a textbook
Yes.
would.
And that is why I always end up my assessment sessions with parents with this one question, that is there something that I have missed out? So I give them this full liberty in terms of telling me something which cars has not asked, or I as a therapist has not asked. So I always ask them, do you think there is more in terms of information, or have I not asked that information? So tell me now.
Yes. So why I am raising this issue quite pointedly of this area of error, because as clinicians, when a report is served to us, there is a score, there is a number, and often I have seen even in pediatric neurologist setups where they do car score, they will write the final number. But if you actually go through the car's score testing, there are, as Dr. Purnima said, there are categories. And within each category, a score needs to be mentioned. Now, if you get a report saying car score 34, for me, that report is useless because the number doesn't tell me anything. They will say either moderate, severe, mild, whatever. Therefore, what is important is to ask the psychologist to get a very detailed, comprehensive report. Because if I have to become wiser in my prescription, then these scores become important. And often, looking at the scores, I would probably get a hint in my history as to what area needs to be explored, which probably I have missed in my first interview. So, what you have observed about the child in the clinic, what Purnima gives me in her reporting, if they are not in sync, then there is something for me to look into. Often I will call her up and ask her, Purnima, this कुछ difference लग रहा है मेरा observation में. How do we resolve this difference? So many times we are chatting about these kind of differences and disparity in our observations, and then something new insight emerges as to the understanding of the child, and that very often cracks the case. So whenever you ask for a psychometric assessment, request the expert to give you a comprehensive, detailed report, not just the final score. Also, from the homeopath's standpoint of view, we need to document our science. If we are not going to document our science, nobody is going to listen to us. If you are going to say, I treated this autistic child and now this autistic child is started going to mainstream school, you can clap for yourself, your fraternity will clap for you, but the world isn't going to listen to you. So this is also another very important point. Also, further, Purnima, what could be the possible source of error in the ISA test?
The biggest error I think that ISA makes in terms of figuring out whether the child is on the spectrum or not is there's no uh, there's no way where you can verify whether the parent is telling you the exact observation, because the statements are so bland. They will simply ask, the child can sit for few minutes. Now, if you ask an Indian parent, उनके बच्चों में कभी कोई कमी होती ही नहीं है. So they usually end up giving you very standard answers. And those standard answers may not exactly help you in understanding the scale on which the spectrum exists for the child. If the child is, for example, if there is a statement called the child can eat on his own, I don't think this general statement can really help you understand what is the level of the child's skills. Can he hold a spoon? Can he eat with his hands? Can he break the chapati with his fingers? Can he mix rice and dal? Does he understand the difference between rice and dal? Because the sensory stimulation is something that you will have to understand here. Is the child loving the smell of dal? Is the child loving the smell of ghee? Because a lot of children I have observed, they are quite repulsive to strong smells, as good as ghee or oil or maybe garlic or onion. So, how do you understand the sensory stimulation or the sensitivities of a child? So, when the statement is very simple, it is not asking you to think critically. It is simply asking you for a binary response, yes or no. And
So in
most
sorry.
of the parents who come from lower middle class or even middle class, cognitively, they are not that enriched and empowered that they can understand the criticality of the statement. I have heard very few parents telling me on their own the subtle dimensions of the question that I have asked.
Yeah. So from the homeopath standpoint of view, the ISA scale is more like leading questions, where you have yes or no answers. And then we all know what are the problems when we ask leading questions. So the subjectivity of the parent, the subjectivity of the one who answers creeps into it, keeping away what the real thing is. So this is very interesting for me also to learn, because earlier I would not encounter so much of ISA testing, but now I see more and more of it. People are doing it more and more. And I was always taught that the gold standard of assessing an autism level of autism is a childhood autism rating scale, which is the CARS. Also, Purnima, what are the other psychometric tests you would want to do in an autistic child?
So, to be very honest, if we have taken in depth case history from the parents, we may not need any other assessment because uh, to be precise with it, the assessment and the reports, they they actually put our thinking in boxes. Then we do not look outside those boxes. So my suggestion to all the practitioners, whether psychiatrists or homeopaths, I always tell them do the test only because it is necessary, not because there is an option. So we may have a lot of options in terms of assessments and diagnostic techniques, but then it kills your prowess as a doctor. It doesn't allow you to, figure the case or understand the case as it moves forward. So assessments बहुत सारे हो सकते हैं, but जरूरी नहीं है उनको करना. The real insight develops when you play with the information, when you allow your mind to just play with the information. And oftentimes it happens कि कई बार if I have missed out on something when I'm sitting and reflecting on the information, it suddenly occurs to me कि the mother was not at all, shifting her sitting posture. Now that actually tells me a lot about her. Or it was the father who was constantly monitoring the child. Or it was the father to whom the child was actually listening to. The child was not bothered about what the mother was doing, or vice versa. And these insights, actually, these epiphanies are the real information, real pieces of information. So assessments हो सकते हैं, आप developmental assessment कर सकते हैं, आप comorbid problems के लिए assessments कर सकते हैं. But always ask yourself, are you using assessments because you do not want to sit with the information and decode it, or you really want to allow your mind to think in boxes and not outside the box? That's my take. You may disagree with this.
So my experience tells me, because as homeopaths, we have no option but to sit on the information and think about it and integrate it. If I were a psychiatrist or I would have been another practitioner, maybe the diagnosis would be enough for me to plan out the treatment. But
One thing that I usually do with my kids is I always give them a color pen and paper and let them play with it. So that's something which is additional and not prescribed, but I do it.
so, as I was just saying, that we as homeopaths cannot allow ourselves to sit in a box, because the moment we do that, we lose our ability to make a correct prescription. So for a homeopath, I personally feel that getting the assessment report is complementary to the history that we take in our clinics. Therefore, I personally am of the opinion that homeopaths first must know what are the tests available, and then wherever possible, get them done. Also, Purnima, we know that there are a lot of comorbidities like attention deficit, hyperactivity, and very commonly we have the mental retardation or intellectual disability in these kids. So what are the tests? Very, very briefly, we will end the session in another 5 minutes. Very, very briefly, if you can just go through the tests that you would do with these kids.
See, choosing a test out of the list is easier, but choosing a list depending upon what the child can do, because not all the tests are reporting questionnaires or scales. So the child should be able to perform, and most of the intelligence tests would have subtests based on performance and verbal. And we know on the spectrum, these both are compromised, so
Yeah.
not suggested. So I would rely on the information which I receive from the parents through shadow teacher, or information in terms of what the child has been doing at home, or the drawing books or the writing books. Those are the important pieces of information. As far as IQ tests are concerned, you can use WISC, you can use MISIC, you can use Stanford Binet. But as long as the child is not able to perform, these tests are,
Because
they
most
lead
of
us.
these are performance based, right?
Yes. So they lead us nowhere. And even if it is not performance based, it is verbal. And both the areas, the child cannot give you the information. So
Correct.
that's where you cannot do much about it. So you have to rely on the information that you get through parents.
Correct. And the ADHD scale?
Again, a self-reporting questionnaire, the parents only have to fill it. So then
Fill it
you have to translate the statements to the parents in their native language so that they can understand and then tell you the answer.
Right. So this is what a glimpse of what we are going to do in the part 2 of Roadmap to Autism, starting in December. The details are there in the link below. So do enroll, do share this information with your colleagues and your friends. And we thank you, Purnima, for giving your time. And we are looking forward for your session in December with the part 2. We've already done a wonderful session in part 1. For those of you who are in part 1 are already familiar with how Purnima looks at autism. In fact, the feedback that I get after the first session, after your session, was That was the stickiest session and gave it a completely new dimension of looking at this child, autistic child. So do sign in for very, very valuable insight. We are going to get in the other speakers in the live format so you can interact with them. I will open up for questions for half a minute. Anybody wants to ask any questions to Purnima, welcome. They can unmute themselves and please ask your question. Do put on your video on so we can also see you. So any questions, feel free to ask. Okay, so you can also post in your questions in the YouTube comment section. We will try and reach out and answer those questions. So good night and see you all at the webinar series. So take care and thank you, Purnima, for being here. Bye.
Bye.
One second.
Bye.
I think there
Yeah.
is some question in the chat. Just hold on. Okay, no questions on YouTube also. Okay, Purnima, see you. Bye.
Bye.